Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. Please remember that these conversations are not intended to replace your regular consultations with your regular physician. If you have concerns, please make an appointment with your doctor to be seen. We'd be happy to see you here in our office, same day if need be, 775-359-7111. Today, let's talk about croup. The medical name for croup is laryngotracheal bronchitis. And it's a very common disorder in the spring and in the fall. Sometimes we see it in the mid to late winter as well. There are a dozen things that can cause croup. Croup can be caused usually by viral illnesses. It can be caused by influenza. It can be caused by a virus called RSV, or respiratory syncytial virus, but most commonly it's caused by something called parainfluenza or paraflu. Now, paraflu is sort of similar to influenza, but it doesn't make you quite as sick. In the case of young children, it often lands itself in the upper respiratory tract, resulting in some inflammation right below the vocal cords. As a result of that, the kids wind up with a barky cough, usually described as brassy or seal-like. So when you say that your child has a croupy cough, what we as physicians are automatically assuming is that you sound kind of like a barking dog. That cough is always worse in the middle of the night and early morning. Nobody completely understands why that is, but it's a well-known fact. During the daytime, many times the kids are better. However, if your child had a bad night last night, it might be worth being seen in the morning because tonight is likely to be worse. The inflammation that starts in the vocal cords and right below the vocal cords often gets worse for the first 3 or 4 days and can make it so difficult that the child has difficulty breathing and actually lands themselves in the hospital. This can often be prevented by a single dose of steroids. We usually use something called dexamethasone or Decadron. It can be given either orally or an injection, and it's given one time. This goes a long way to helping prevent the increasing swelling in the upper airway. And some more recent research shows that maybe it actually helps you to get better faster. The cough for croup can last for up to 2 weeks, so patience is very important. Along with this, you often get runny nose and fever for 3 to 5 days. If your fever exceeds 3 to 5 days, though, we do want to see you back. Sinus infections and ear infections are common following croup, and those probably need to be treated with antibiotics. It's impossible to know who's going to have a sinus infection or an ear infection on day 1 of the fever, so the only thing we can do is wait and see if things get better. But if they don't get better, we do want to take another look in your ears. And if you start again with fever anytime in the next week or 2 after an infection with croup, let us see your child, because things might have been good 2 days ago, but that doesn't mean you don't have an ear infection today. What else can you do at home for this? Steaming the child in the shower often makes things a little bit better. And then running a humidifier if you live in a dry environment during the bedtime when the child's in bed, especially living in the desert like we do here in Reno and Sparks. If you think your child has croup, if you're concerned that your child has croup, please make an appointment to be seen. We'd be happy to see you. If your child's having difficulty breathing, you need to be seen right away. Consultations can be scheduled with my office, area code 775-359-7111, and we'll get you in same day if we need to. Hopefully we're not needing to see you for this, but it's very common. If it happens, give us a call.